In January of my senior year, I set off to begin my career as an elementary education major. Fast forward to a few months later, my then boyfriend and now husband and I decided to go to my senior prom. About halfway there, we witnessed a horrific crash and were the first people on the scene. Somebody nearby called 911, and then we waited for the ambulance to arrive. It was truly the longest 30 minutes of my life. We had no idea how to help these crash victims or what to do, so all we could do was sit there and hold their hands. The next day, my husband and I had a conversation about neither one of us ever wanting to feel that helpless again. So we both registered for an emergency medical technician class at our local hospital. While taking the EMT class, a respiratory therapist taught us CPR. She told me about her role in helping patients who are struggling to breathe. I reached out to the program director at our local program and then asked a few questions and then changed my major. Shortly before graduating from my RT program, a friend and I were at my apartment. We decided to go to the pool for a few hours. As I rounded the corner, head into the pool, a maintenance person was pulling a 5-year-old out of the pool. I immediately ran over and checked to see if the little boy was breathing and if he had a pulse. Luckily, he did have a pulse, but he wasn't breathing. I began mouth-to-mouth resuscitation, and luckily, within a few breaths, he began coughing and crying for his mom. While my EMT training provided some knowledge and a good foundation, it was my RT preparation that gave me the skills to act. I really didn't do much other than give him a couple breaths, but that child's cries was a wonderful sound. The feeling was so much better this time around than feeling the helplessness I felt earlier. Changing my major to respiratory therapy 30 years ago was one of the best decisions I ever made. Respiratory therapy is a rewarding career and continues to provide me opportunities to advance. I'm blessed to be a respiratory therapist.